I'm not sure that it's a manual therapy, but I would say the most powerful method that I've ever learned, and I'll explain why, would be called reflex locomotion. And unfortunately, I'm not even sure where to learn it anymore. Every so often, I think there's a chiro, I can't think of his name, that would teach some of these concepts. It was founded by a gentleman named Vojta, but I learned it through DNS, where back in the day when DNS was a lot more fun, the curriculum was just much, much different. And actually very, very similar to the second most powerful tool that I know of, which is dry needling. There's a lot of complaint. Like for instance, it would take 2 years minimum to be Vojta certified, and I could learn how to do a different version of reflex locomotion in DNSA, where we started to learn it, and maybe that was a 4-day course or a 3-day course. Similar to dry needling, acupuncturists don't think that physiotherapists should dry needle because they take years to learn their methodology, which is not anywhere resembling dry needling, and a physiotherapist in certain states can dry needle, after a certain amount of hours. It's usually more than one course. When people ask, like, what's the most powerful tool? Reflex locomotion, I have to qualify its power since the patient is literally laying in a particular position. They might be on their side, on their back, etc. You're using your hands, thumbs, maybe your fingers, but mostly your thumbs, and just putting force gently in particular directions. And all of a sudden, pain and what has to then be a stability motor control deficit just go away when you do it correctly. And clearly at my level of acumen, which is I cannot suggest is very high, it works sometimes. And the stories of reflex locomotion being able to elicit what's called an anticipatory pattern, if your hands or your jumper cables are powerful enough and the individual is receptive enough, you can actually have them move almost like a puppet. And I've been able to do this at times. And that's not just because I'm special. A lot of people have done it. And I have seen people actually go from the standing position from supine, doing their little version of a Turkish get-up. And when you see it done and you're learning it from credentialed, proper people that are trained in this, one of the things you're looking for is if they're using a strategy, for instance, that should be centrated with this relative external rotation, but they're getting up with this internal rotation, then you know you have a major problem. And there's a lot of ontology to that. You can't prove it, but that would be the methodology that they're teaching, and you can do what you wish with that. I have never gotten somebody from lying down to standing, but I have seen it done. Unless the whole thing was staged, then shame on me for buying into it, but I don't think it was. Because I've done it. I've seen people's hands move like this. Using someone's ASIS, again, in the proper way, you play his hand like a fiddle. There's a lot of really powerful things, and really it's about this uprighting, where if let's say you're in what looks like roadkill position, so you're in this, it's reflexive crawling, I think it's called, and you'll start to see kind of thoracic extension, this uprighting position. So that's a little bit about reflex locomotion. If it's interesting, look it up. If you find a good course, let me know. I'd love to get back into it. It is hard, though, to do that and then not get a result. You wasted a lot of time. This isn't like dry needling that takes literally seconds, and if you don't get a result, or even other types of manual therapy or manipulation that takes seconds. So I would talk about dry needling. I don't know that the suite of courses are the same as what they used to, because for the longest time I would have said Kineticore was, because it was the first course that I took, and I don't believe that that's a course anymore. I think they got absorbed by another company. But from that model, I don't know the name of his course, but I want you to look up a name, Nelson Min. I went to athletic training addendum school with him, and I'm very proud to see that he has his own dry needling course, and I'm guessing that the methodology would be very, very consistent with Kineticore he used to teach there. That would kind of be the Travell and Simons, and everybody has their own adaptations, of course, to have their own commercial model, but the Travell and Simons or Manel preceding that model, Rhizopoulos and Kostopoulos, I think they only do it online now. So all of these models are a very traditional map of a neurological phenomenon, as my friend in the UK reminds us of. So push here, feel here. We need that trigger point needs to have this common referral pattern, also be tender, also have a taut band, high sensitivity. There are all these checks that need to be made in order to call it a trigger point. So Kineticore used to be a place that was kind of the best overall, and you had a lot of really great practice on how to actually needle, because it can be a little unnerving the first time you ever do it. You can needle the table, you needle a banana or an orange or an apple, et cetera, et cetera. So that was number one. I think the hands down, in these courses I still attend, full paying, prefer to sit in the back of the room, the absolute most scientific merit. Anybody who says dry needling doesn't work, anybody who says it's a sham, anybody who says trigger points don't exist, I think there's significant research that you'll learn in James Dunning's courses. I recently took one in Vegas. As far as repetitions, protocols, now they're not teaching needling in the same way that Nelson would. They're basically, probably valuing homeopathic points. Maybe other people call them acupuncture points. I'd prefer that not be used because it's not acupuncture. Acupuncture is using needles to affect, and I'm not even trained in this, so I don't even know if this is correct, but what I would say is that you're affecting meridians and energy and laws of Asian medicine. I think acupuncture works. I have paid people to apply acupuncture to me. That's not what James Dunning's teaching. He's using needles to affect nerve, muscle, or bone, and taking advantage of points that we know are very effective for Western science-based reasons. So as far as the best for Western approach, but using non-necessarily trigger point-based methodology, those would be the two that I would look for. But I do think overall, if you're going to use needles and get the most out of them, I think we need a trigger point method. I think a very local method, at which point you are entitled to put the needle wherever you want, where I would use a needle anywhere I would want to see a more relaxed contractile element. So it doesn't always have to be a trigger point. I'll use needles instead of my hands. I'll use needles instead of why someone else might use a foam roller. I think they're all relatively you're being used for the same reasons. They're not doing the same thing physiologically. But if you see an area that you want to be relaxed for the purpose of changing movement, if you're looking to change the reset evaluation of can joints get in the right positions to absorb and adapt to stress, you can put a needle wherever you want. If you would stick your thumb and do some cross friction, you can put a needle. I'm not giving you permission to do anything. I'm saying this is how I would use it. So, but that model is very, very similar to trigger point, but I would put it only in that spot where I think the trigger point is supposed to be to impact pain somewhere else. If it doesn't work, you move on very, very quickly. If it does work, you can then create this irrelevance to any pathoanatomy that could have been contributing to that pain. So you could have a miserably arthritic AC joint. If you needle infraspinatus 3 and the front of your shoulder pain is gone and all of your movement is normalized, then you should be able to say that the AC arthritis is completely irrelevant. So that's one way. Number two, in more comprehensive situations where there's a lot of time for the individual sessions, but also a lot of time overall to create your end result, you would treat everywhere in the dermatome. So now if we are going to talk about the C5, which would be my anterior shoulder pain, I am not going to needle infraspinatus because that's in C6. I'm going to needle C6 to get it going. That confirms that the pain was in C5, but then I'm going to probably hit somewhere in the deltoids. I'm going to hit somewhere in the biceps. I'm certainly going to hit multifidus in C5. So you start with the trigger point, and then you establish your dermatome, and you would just say garbage in, garbage out. That would be another way to establish a treatment chain. You always look at something that's next to it, and then you look all the way up and down the dermatome, you look all the way up and down the peripheral nerve distribution, and you're starting to build out chains of treatment. Again, we're requiring a longer period of time to really deliver an elite result. Chan Gunn would be the name that I was first exposed to, who said that wherever there's pain, you have to treat all the way up and down the entire dermatome. Okay, and then thirdly would be like the Dunning methods. I would represent my knowledge of that product, commercial product, to be that if somebody were to, and I've actually done this, and it checks out. You find every research paper that ever lived on somebody using needles, and of course most of those research papers are going to be using traditional acupuncture, Asian medicine, but use Asian medicine for joint pain. So I'm going to find every research paper on earth ever that use needles to treat knee pain. And then I'm going to remove any points that don't make any sense according to any fascial, neural, myotomal, dermatomal, sclerotomal chain. For instance, I have no way of linking your cheek to your knee in terms of a pain pattern. So we don't use those. We only use the ones that would be relevant and make any kind of sense for the knee, and there's your knee package. So now, especially when you're working with an athlete over the full season, hey, we got to do our knee packages. Yeah, take a nap. I'll set the zapper for 30 minutes. So for other areas where we do value or have the time, because I don't like needling somebody, hooking up the alligator clips and then walking away. I just don't feel like someone else can do that. I can do something else. Like I don't often, if ever, treat multiple people at once anymore. So, but that's a different methodology for needles, and I think you have a subscription to some form of all three, and you can see how they can play into each other as well. I think you'll have your champion for most powerful method. Reflex locomotion I talked about earlier, almost as a sidebar to segue into dry needling, and but reflex locomotion is some really interesting stuff. Very, very easy to be skeptical about it, but I don't really know where to learn it much anymore.